Welcome to United Medical Institute. Maybe you are just starting to explore a career in diagnostic medical sonography. Maybe you are already completing your associate degree. Or maybe you have graduated, you are working in the field, and you are beginning to ask yourself an important question: what comes next? That next step may be more than earning another degree. It may be a chance to deepen your sonography education, add new clinical knowledge, qualify for more professional opportunities, and create a stronger path for long-term career growth. At United Medical Institute, students continue into one of two bachelor's degree pathways. You may choose to build more broadly on your diagnostic medical sonography education, or you may choose to add focused education in cardiac and vascular ultrasound. For graduates, these programs are designed to build on the education and experience you already have. For current and future United Medical Institute associate degree students, they also create a coordinated path that may begin during the final clinical phase of the associate program. In this presentation, we will walk through both options, explain who they are designed for, and help you see how your sonography education can continue to grow with your professional goals. Once you have the foundation of a diagnostic medical sonography education, you have two bachelor's degree options at United Medical Institute. The Bachelor of Science in Diagnostic Medical Sonography allows you to build more broadly on your general sonography education. The Bachelor of Science in Diagnostic Cardiovascular Sonography allows you to add focused education in cardiac and vascular ultrasound. Both programs build on the same foundation. The difference is where you want to take your career next. And if you are a current United Medical Institute student, you may be able to begin one of these bachelor's degree programs while you are still completing your associate degree. There are two ways to enter a United Medical Institute bachelor's degree program. If you are already a diagnostic medical sonography graduate, whether from United Medical Institute or another school, you must have completed your diploma or associate degree and be working or volunteering in the field. Your previous diagnostic medical sonography courses and eligible general education courses will transfer into the bachelor's degree pathway. If you are a current United Medical Institute associate degree student, your timing is different. Once you complete your academic coursework, finish about 280 to 300 clinical hours, and begin Clinical 3, you may be able to start the bachelor's program while continuing the final clinical phase of your associate degree. At that point, you are not required to be employed yet. However, after you complete the associate degree, you are expected to actively look for work in sonography and begin working in the field while continuing your bachelor's studies. For current United Medical Institute students, this is where the transition can become especially valuable. After you complete your associate degree coursework, finish about 280 to 300 clinical hours, and begin Clinical 3, you may be able to start your bachelor's coursework at the same time. While you continue completing the remaining clinical hours for the associate degree, you can also begin moving forward in the bachelor's program. You still complete and earn your Associate of Science degree in Diagnostic Medical Sonography. Then, after you finish the remaining bachelor's degree requirements, you earn your Bachelor of Science degree as well. The bachelor's program does not replace the associate degree. It builds on it, so you graduate with both degrees. Now let's talk about transfer credit. These bachelor's degree completion programs are built on the curriculum of a standard diagnostic medical sonography program. For United Medical Institute students and graduates, your diagnostic medical sonography courses transfer directly, along with the general education courses that apply to the bachelor's degree. For graduates of other diagnostic medical sonography programs, your standard sonography courses and eligible general education courses will also generally transfer. That means you are not starting over. The bachelor's curriculum begins where the associate degree curriculum ends. From there, you move into upper division coursework, specialty courses, and the clinical requirements needed to complete the bachelor's degree. Because the program is designed this way, the number of remaining credits and the tuition are generally similar for most bachelor's degree completion students. Graduates entering the program are expected to continue working or volunteering in sonography while completing the degree. Current United Medical Institute students are expected to continue Clinical 3 without interruption as they begin bachelor's coursework. Because of that, most live remote academic classes in the bachelor's programs are scheduled on Saturdays, with some course activities completed online at other times during the week. In the Diagnostic Cardiovascular Sonography program, the concurrent clinical activities are typically scheduled in the evening to reduce interference with work and for current students with the remaining associate degree clinical hours. The exact schedule may vary by course, term, and clinical site, but the program is structured to support students who are already working or completing clinical training. So why continue to a bachelor's degree? Because your career may grow in directions you cannot fully see yet. Today, your goal may be to become a skilled sonographer and build confidence in the field. Later, you may want to teach, mentor other sonographers, take on more responsibility, add another specialty, or continue your education even further. A bachelor's degree gives you more room to grow when those opportunities appear. It is not only about earning another credential, it is about giving your future self more choices. Now, imagine where those choices could take you. You may discover that you enjoy helping students learn and decide to become a clinical instructor or faculty member. You may become the person newer sonographers turn to for guidance, training, and support. With experience, you may be ready for a lead sonographer or clinical coordinator role, helping a department maintain quality and organize patient care. You may pursue opportunities with larger healthcare organizations, continue into graduate education, or qualify for additional professional credentials. You may not know today which of these paths will be right for you. But for many of these opportunities, a bachelor's degree may be required, preferred, or simply help you stand out among other qualified candidates. That is why earning the degree matters. It gives you more than another line on your resume. It gives you a stronger position when the opportunity you want becomes available. Let's look first at the Bachelor of Science in Diagnostic Medical Sonography. This program is designed for students who want to build more broadly on the sonography education they already have. You will continue developing your knowledge in obstetric and gynecologic ultrasound and vascular ultrasound, while also adding coursework in musculoskeletal imaging, introductory echocardiography, and cross-sectional anatomy. You will also complete upper division general education courses that support your growth as a healthcare professional. The program includes a 480-hour diagnostic medical sonography internship. Those hours may be completed through approved paid employments, volunteer work, or another approved internship setting, as long as the experience meets the program requirements. For many students, that means continuing to work in sonography while completing the bachelor's degree. This pathway is a strong fit if you want to deepen your education without leaving the broader field of diagnostic medical sonography. Now let's look at the Bachelor of Science in Diagnostic Cardiovascular Sonography. This program is designed for students who want to complete a bachelor's degree while adding focused education in cardiac and vascular ultrasound. You will study cardiovascular anatomy and physiology, introductory echocardiography techniques, cardiac pathology, advanced vascular ultrasound, and other cardiovascular specialties. You will also complete upper division general education courses that support your growth as a healthcare professional. The program includes a total of 800 cardiovascular clinical hours. You begin with 200 hours of clinical practicum while you are taking your cardiovascular courses. These hours are typically scheduled in the evening, so they do not interfere with your work or for current United Medical Institute students with the clinical externship in the associate degree program. After that, you complete a 600-hour cardiovascular internship. The internship may be completed at your place of employment or at another clinical site approved by United Medical Institute. This pathway is a strong fit if you want to complete your bachelor's degree while developing a new specialty in cardiovascular sonography. Here is the simplest way to compare the two programs. The Bachelor of Science in Diagnostic Medical Sonography gives you a broader path within general sonography. You continue building your knowledge in obstetric and gynecologic ultrasound, vascular ultrasound, musculoskeletal imaging, and introductory echocardiography. The academic portion is about 40 instructional weeks, and the program includes a 480-hour internship in diagnostic medical sonography. The Bachelor of Science in Diagnostic Cardiovascular Sonography is more specialized. It focuses on echocardiography and advanced vascular imaging with 200 hours of clinical practicum and a 600-hour cardiovascular internship. The academic portion is also about 40 instructional weeks, so the choice really comes down to this. If you want to broaden your education within diagnostic medical sonography, the Bachelor of Science in Diagnostic Medical Sonography may be the better fit. If you want to add a new specialty in cardiac and vascular ultrasound, the Bachelor of Science in Diagnostic Cardiovascular Sonography may be the better fit. The clinical requirements also look different depending on how you enter the program. If you are a current United Medical Institute associate degree student, you continue completing Clinical 3 and finish the remaining externship hours required for the associate degree. At the same time, you may begin your bachelor's coursework and continue moving forward without interrupting your clinical training. Once you complete the associate degree, you are expected to actively look for work in sonography and begin working in the field while continuing the bachelor's program. If you are already a diagnostic medical sonography graduate, you enter the bachelor's program while working or volunteering in the field. Your approved work or volunteer hours may then be used toward the bachelor's internship requirement. In both cases, the goal is the same: to help you continue your education while building real clinical experience. Credentialing is another important reason to think carefully about your education pathway. If you are completing the Associate of Science in Diagnostic Medical Sonography at United Medical Institute, you may become eligible to take the Sonography Principles and Instrumentation examination after successfully completing the ultrasound physics course. After completing all associate degree requirements, graduates may also become eligible for the American Registry of Radiologic Technologists Sonography examination. The American Registry for Diagnostic Medical Sonography has several eligibility pathways, and completing a bachelor's degree may create a more direct path to additional specialty examinations for some students. In the Bachelor of Science in Diagnostic Medical Sonography program, those opportunities may include specialties related to general, obstetric and gynecologic, or vascular sonography, depending on your education and documented clinical experience. In the Bachelor of Science in Diagnostic Cardiovascular Sonography program, students may also pursue applicable cardiac and vascular credentials through the American Registry for Diagnostic Medical Sonography or Cardiovascular Credentialing International. The exact pathway depends on the credential, your completed degree, your clinical hours, and the specialty you choose. United Medical Institute can help you understand the available pathways, but the credentialing organization makes the final decision about eligibility. So how do you decide which bachelor's degree is right for you? If you want to stay within the broader field of diagnostic medical sonography, deepen your knowledge, and continue building in areas such as obstetric and gynecologic ultrasound, vascular ultrasound, musculoskeletal imaging, and introductory echocardiography, the Bachelor of Science in Diagnostic Medical Sonography may be the better fit. If you are interested in adding a new specialty and want focused education and clinical training in cardiac and vascular ultrasound, the Bachelor of Science in Diagnostic Cardiovascular Sonography may be the better choice. Both programs build on the diagnostic medical sonography education you already have. The right path depends on the kind of work you want to do, the clinical areas that interest you most, and the opportunities you want to create for your future. Let's review the pathway. You may begin with the Associate of Science in Diagnostic Medical Sonography and then choose the bachelor's degree that fits your goals. You may continue into the Bachelor of Science in Diagnostic Medical Sonography and build more broadly within the field. Or you may continue into the Bachelor of Science in Diagnostic Cardiovascular Sonography and add focused education in cardiac and vascular ultrasound. For United Medical Institute students, this can be one coordinated path from the associate degree into the bachelor's program. You complete and earn the associate degree first. Then, after finishing the remaining bachelor's requirements, you earn the bachelor's degree as well. That means 2 earned degrees, a stronger educational foundation, and more options for where your career can go next. Thank you for taking the time to learn more about United Medical Institute's bachelor's degree programs. Whether you are preparing to begin your sonography education, currently completing your associate degree, or already working in the field, we hope this presentation helped you see what may be possible next. To learn more about our programs, admissions requirements, tuition, and degree pathways, please visit our website at unitedmedicalinstitute.edu. We look forward to helping you take the next step in your sonography education and professional growth.